I'm Kathy Rollo, and I am Superintendent of Lubbock ISD.
I'm Rick Rodriguez, and I'm the Chief Operations Officer for Lubbock ISD.
GermBlast is our partner in keeping kids and staff well.
Our partnership is a tool for us to maintain funding by keeping our kids healthy and in school.
I think anytime you have a large number of people in a space, there's a risk of infection. GermBlast is a way to help mitigate that and minimize that so that we are keeping kids healthy and in school and learning. As a school district, we're charged with ensuring that our students are getting a high quality education to prepare them for their futures. But I also believe that part of our greatest responsibility is keeping our students safe.
When the parents know that we have this partnership with GermBlast, it gives them the confidence that I can send my kid to school and they're going to be okay.
When they send their kids to school and they see that GermBlast sign that is in the yard of the school, I think that gives them a sense of safety and trust that we are taking measures to help mitigate the spread of illness.
Finding every possible way in the time of limited resources and a declining enrollment school district, making sure that we can capture every bit of resource that we can, means that we get kiddos to come to school.
For every 1% increase in our attendance, for our district equates to about $1.5 million. So if we can have strategies in place, GermBlast being one of them, to help us increase that average daily attendance, we're talking about increased revenue, which goes back to our kids in other ways. But again, it's more important that they're there so they can learn, but it is a financial situation as well.
The byproduct of them coming to school and learning is that we get more funding. Man, I'm on board with that.
I mean, we need our staff well as well. You know, we believe that our staff has more confidence in our schools being healthy environments with our GermBlast partnership. You know, there's not a plethora of substitutes ready and willing to take over when they're homesick. So we need our staff there. And then I think families overall, because if kids get sick at school, they're taking germs back home to the rest of the family. So I think it's definitely beneficial for staff and our families that we serve at large.
We are a self-funded health plan, and so when our staff gets sick and they go to the doctor, then that's going to have an impact on our health plan. And so if we can keep them healthy and making sure that they're in the safest environment, then again, more importantly, they're at school teaching kids, but they're also not at home going to the doctor, getting prescriptions and those kinds of things that if we could have mitigated it, and we do with our partnership with GermBlast, then that helps us maintain a very healthy health fund for us to provide a really good, robust health plan for our staff. So it helps in that way on the financial side of things.
We're very confident that it absolutely would look differently if we didn't have this partnership. We've been in partnership with GermBlast for many, many years now, and I'm not willing to stop using it to see. I'm just not willing to take that risk.
The investment of getting kids to come to school, keeping staff at work for the price, I think the return on investment is very positive. And to Dr. Rollo's point, not willing to check that and see how much more positive it is, because I do think it's a risk that we would take and not a risk that I'm willing to support. So I think staying with the partnership and maintaining that partnership is where we need to be.
This partnership with GermBlast is one way of saying we're doing our part. Now parents, we need you to help too and make sure you bring your child to school every day.